the issue of the vice presidency itself, this country was founded with the term, all men are created equal. But what that really meant was property-owning white men. At the beginning of this country, blacks were considered 3/5 of a person. Women weren't even allowed to vote. What would it mean to you, or the little girl version of Karen Bass, the thought of having a black woman as vice president? And when you were a little kid, could you even imagine that possibility?
Absolutely not. It would just be so meaningful. And I think about all of the little girls who grow up and who will never think twice about the possibility because it will be normal and natural to them. I will never forget the moment of where I was when Obama was declared the president of the United States. It was just a breathtaking moment, and it'll be the same thing when the vice president, when Biden chooses who his candidate is to be his running mate. Whoever it is, it will be an incredible moment because it'll be a woman. We know that for sure. And then it would be especially exciting if it was an African-American woman.
And especially exciting if it was you, right? There's, of course, pictures of you and the vice president. Some would say that looks good together. All right, now let's talk about the big issue. There you are talking about the issue of health care with the former vice president. Coronavirus, the biggest issue in the country right now. The Senate holding a hearing on reopening in workplaces today. Dr. Anthony Fauci with a blunt warning for all U.S. citizens. Take a listen.
We can't just focus on those areas that are having the surge. It puts the entire country at risk. We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around, and so I am very concerned.
So the question is, what happened here? Because at the beginning of this process, the U.S. and Europe were sort of on parallel tracks. Now Europe, it seems like, has gotten control over a lot of the coronavirus. The U.S. now has more deaths, more cases than anywhere else. Travel being banned to Europe. Here in California, states on the East Coast are banning Californians from going there. What went wrong, and who's to blame for this? And I know you're going to say a lot of this has to do with the Trump administration, but California is run entirely by Democrats, and we're having a huge spike.
But, it just shows you how serious this is, because the leadership in California, in our state, our governor, our state legislature, and certainly our city and county did everything they were supposed to do, but still, the virus has taken an incredible toll. Now, we would certainly be benefited if we got the appropriate help from the federal government, which was never coming. I remember at the beginning of the pandemic when Governor Newsom was having to hunt around the country for respirators, and where one state was being pitted against another. So I think we did what we were supposed to do. But I think it just shows you how serious the virus is, and we need the leadership. The other thing is that when the states all around us are not handling it appropriately, people come and go. This is a major transportation center. And so I think all of that contributed to it.
You think we did what we're supposed to do when it comes to nursing homes, though? I mean, even the local officials here admit that that was a mistake, and we saw all the deaths in nursing homes in California.
Right, and that was happening around the country, but we also had a number of our counties and cities that wanted to open up, people pressuring to open up. I think that there were people and places in our state that contributed to it as well, and we are such a big state, and people move around a lot. So I think it just goes to show you, when you do have the leadership, we still are in a very tough situation because this virus is so challenging. And so it's one thing to have a disease and it's spreading, but to have a disease that you really don't understand and you're trying to build the plane while flying it at the same time makes it extremely difficult. And I'm worried too. Just think, we did what we were supposed to do. What about those states that didn't? Where Pence was the other day, and he was sitting with his mask on in front of a choir. Now, those people in that choir are going to get sick, so you just wait in a couple of weeks when we see those states get really, really bad, where they didn't do what they were supposed to do.
So we got different questions on this. One of the questions that came into us was Dean Shermay. He works in food and beverage operations for the Edition Hotel in West Hollywood, and he sent us this question.
Is there any data that suggests that people going to bars and restaurants is what's causing spikes, and why should they continue to get punished when it's not illegal to go out and protest, so why should it be illegal to run your small business?
So what's your response to Dean?
Well, you know, sure. There's a couple of differences. Number one, I wouldn't doubt that some of the protests contributed to it as well, but it is different when you're outside versus when you're inside. So you're in a bar, you're in a building. And so we definitely know that that is a big difference in terms of how the virus is spread and how it isn't spread. And so I think, we all have to play our part. Now, on the federal side, we have to get the HEROES Act passed, because pretty soon unemployment insurance is going to run out and people need another stimulus check. So the part that I'm responsible for, we passed the bill out of the House, but I'm here in Washington and I'm responsible to do everything I can to push the Senate to get this bill up to the president's desk.
Yeah, because one of the points that Dean was making, we didn't play this part of the question, is what are you guys going to do to help all the people that are now out of work because of the government's decision? So what is the status of that? Where are we actually at in terms of getting more legislation? The president's suggesting maybe we should send another check to Americans. Is that actually going to happen?
Well, yeah, that check is in the HEROES Act. It's sitting over there in the Senate. When we passed it out of the House, it is sitting there, ready to be passed. All the Senate needs to do is take it up. And I'll tell you what I really think is going to happen. You know, the unemployment runs out at the end of the month. And I hate to say this, I really do, for all of the people that are suffering. But what tends to happen in the legislative world is that we wait until the last minute, and that's when the pressure builds. So for all the people watching the show, and for that young man that had his concern about the bars and the restaurants, make a phone call to Mitch McConnell, because they could take that bill up tomorrow. They really could.
Well, let's talk also about the health aspect of this. Some folks may not know that you used to be a physician's assistant before you were a member of Congress. We got a question from civil rights attorney Areva Martin, somebody you know well, a frequent guest on our political show, The Issue Is. She sent us a question about racial disparities when it comes to COVID. Here's her question.
Now that we're seeing the spike of cases all over the South and the Southwest, particularly here in California, can we expect this White House to develop a strategy to address African Americans, Latinos, and other communities of color that have been hit hard by coronavirus?
Can we?
Well, you know what? I'm sorry to say the answer right now is no. But I will tell you we've been trying, and let me tell you specifically what we have done. When we passed the last bill, the CARES Act, we put in there an order for the Center for Disease Control to give us the data. It's really hard to address the problem if you don't exactly know where it is and how bad it is. So the only information we have right now is pretty much anecdotal in terms of where the disproportionate rates are. What I believe needs to happen is that we need to have a very specific intervention. And it's not just racial data. Just think about the people at the meatpacking plants who were forced to go to work. You need to do massive testing, massive contact tracing, and massive early intervention and treatment. You know, there's some good news in the LA area. Martin Luther King Hospital, Dr. Elaine Batchelor, who is the head physician there, she's been having quite a lot of success with African American and Latino patients there by treating them early and being very, very aggressive. What I'm worried about is happening in a lot of our hospitals around the country is that African American and Latino patients are going in and they're being sent home and they're told to quarantine in your home. Well, if you live with a lot of people, depending on what your circumstances are, you're not necessarily able to get the care that you need.